Good morning. Thank you for including and inviting us today. I'm James Schuster. I'm the Chief Medical Officer of the UPMC Insurance Services Division, including UPMC Health Plan. And I'm here with my colleague, Dr. Ellen Beckjord, and I'll let Ellen introduce herself.
Good morning, everyone. I'm Ellen Beckjord. I'm the Associate Vice President of Population Health and Clinical Transformation at UPMC Health Plan. It's great to be with you today.
So we want to talk to you this morning a bit about telehealth and digital health from a health plan perspective. For those of you unfamiliar with UPMC Health Plan, it includes a number of different companies which total over 4 million members, primarily but not entirely within Pennsylvania. So in addition to the enterprise division that you've heard about this morning and the health services division that you've heard from, UPMC also has this large insurance services division. It includes products for commercial customers, Medicare, Medicaid, a suite of products for employers, as well as a vision plan and a dental plan. So our goal really is to try to use digital and telehealth technologies in order to create an optimally patient-centered system for our members to use. We really see this as having a combination of hands-on services, in-person care, digitally enabled care, including video visits and e-visits, and remote monitoring that could be synchronous or asynchronous in nature. Our goal is really to try to support population health strategies across all acuity levels, really ranging, including inpatient, although primarily outside of hospital settings. And the goal is to really try to optimize the use of providers for our members. Certainly within the United States, as well as everywhere else in the world, there's really a shortage of healthcare providers compared to the demands of the population. And we really see tele and digital strategies as key to helping us use the available resources most effectively for our members and to make them most accessible for our members. There's certainly been a significant change in terms of how consumers and our members perceive digital and telehealth over these last really 12 to now probably close to 18 months since the onset of the COVID pandemic. What we had found previously was that our members who use telehealth or other digital services were generally satisfied, but most of them had not used them and didn't necessarily see them as an option. But what we found since the onset of the pandemic is that many more of our members have used digital and telehealth services, and that the satisfaction scores have remained high, and that they are by and large open to continuing to use them going forward. They see them as really helping to address and minimize a number of their barriers to care, including transportation and time issues and cost, particularly childcare. And just speaking even from a personal perspective, I found that using digital and teleservices is really very time efficient. Obviously, it eliminates a lot of transportation time as well as significant waiting time for the patients. We've also found a significant increase in the engagement of our providers in telehealth. The graph on the left is really kind of an average number of providers using telehealth over these last 18 months. The average has been about 25%. In April of 2020, when the COVID-related restrictions were at their peak, we reached about 50% of providers, and we've now settled back to about 25%. Our goal certainly is to continue to support providers so that we can continue to grow that number over time, because we think that telehealth really can support convenience and effective care for our members. And as you can see in the prior slide, on the whole, members are very happy with it. So our goal is to continue to support providers to grow this number over time. And we've been working to really change our policies to support both our members and providers in the expansion of telehealth. Even before the onset of the pandemic in January of 2020, we adopted a very expansive telehealth policy, which included payment parity for teleservices versus in-person services. So this has been one of the big challenges for providers in terms of adopting telehealth, and we felt it was important to really address that proactively. CMS and the Pennsylvania Department of Human Services, DHS, added a number of services for reimbursement for Medicare and Medicaid members during the COVID pandemic. And we, by and large, replicated those additions for our commercial members as well. Going forward, we see that many of those service expansions will likely continue. And we certainly are including lifting any restrictions on the originating site of the telehealth work, as long as the originating site doesn't infringe on any HIPAA issues, and that patient confidentiality can be adequately protected. In addition, we're likely to move away, as CMS does, for coverage for non-HIPAA compliant platforms. And again, our goal is to really try to be out in front of any state level payment parity requirements, and we've really already achieved that in our own policies. So that's a brief overview of our telehealth experience, and I'm now going to turn this over to Dr. Beckjord, who's going to talk about some of our other digital activities.
Thank you, Dr. Schuster. As James discussed, we've had significant expansion of telehealth across our member population with respect to utilization and provider engagement. But to meet the needs of our members during the pandemic, many of our clinical services that we provide from within the insurance services division, care management services, case management services, health coaching services, to name a few, we recognized that there was also a need to figure out ways to connect with people differently during the pandemic. And so we've had significant adoption internally of the use of our telehealth platform to deliver these services, which in some instances we've been delivering face-to-face in the community, and when we could no longer do that, changed to a synchronous video platform to still have that face-to-face interaction with our members. But we've also recognized that we have a new opportunity to deliver synchronous video services as an augment to or an alternative to telephonically delivered services, that it's a qualitatively different experience to connect with someone face-to-face over synchronous video. And so you can see on this slide, we've really expanded the use of telehealth for delivery of some of our clinical services that historically had just been provided telephonically to great effect. One of the specific examples we wanted to talk about because of its relevance to some of the challenges that members have experienced during the pandemic is the use of synchronous video to bring telehealth services focused on behavioral health to our members. So for the vast majority of our members who have access to our Life Solutions benefit, which provides free benefits around a number of sessions for behavioral health counseling for people who need it, we've moved into offering that via synchronous video. And so there's been a large expansion in access to licensed professional counselors who can deliver evidence-based behavioral health treatment via synchronous video for our members. And it's been a major benefit to our members to be able to access those services during this time when behavioral health challenges have certainly been on the rise. Similarly, we've gone from just telephonic to synchronous video delivery of our care navigation service. So within the insurance services division, we have an operational capacity focused on helping our members navigate different options for care, both within the healthcare system and within the clinical services that we provide. And again, by moving away from pure telephonic to the addition of synchronous video, we found that members have responded very positively to the opportunity to connect with our clinical navigators in a different way. And it's been an excellent expansion of the use of our telehealth platform internally within our clinical services at the health plan. Beyond telehealth, we've also made significant headway in offering digital modality as a way for our members to access our services that are intended to help them improve health behaviors or manage symptoms of anxiety, stress, and depression. Much like our payment parity initiative preceded the pandemic, our translation of these telephonic services onto a digital platform through a mobile app called RxWell preceded the pandemic as well, but we've been happy to see the utilization of this really increase during the pandemic. So our mobile application called RxWell offers digitally enabled services for the most common primary prevention drivers of chronic conditions to help members achieve health behavior change with respect to weight management, improving physical activity, improving nutrition, smoking cessation, and reducing stress. But we also have, or will have very soon, the ability to offer evidence-based services on this mobile application platform for sleep management, for diabetes self-management, and also address behavioral health with depression and sleep coaching. Members can use RxWell in a completely self-directed way, but they also are always offered the availability of a digital health coach, which is a way that we really try to leverage the connectivity that RxWell provides with the opportunity to make an authentic connection with one of our digital health coaches. Digital health coaches are highly trained in motivational interviewing, follow very specific clinical protocols, and asynchronously communicate with members using RxWell through the RxWell platform to both guide members through the content available in RxWell, help them problem solve and goal set on their health behavior change journey. And we know that when members make use of the digital coach available to them, we see significantly better engagement with the content available through RxWell. And we see the majority of members using RxWell opt in to engage with one of the coaches who are available to guide and support them. And finally, throughout all of this work focused on the expansion of the use of telehealth and digital tools, we're paying very close attention to an emphasis on equity. The digital divide is still alive and well. Compared to 10 years ago, it's much less now about who has a mobile device and who doesn't, and more about who has access to broadband internet, who has the economic resources to pay for access to broadband internet when it's available. Some of our catchment areas in very rural areas where broadband isn't even available for those who might be able to afford it. And we know that that kind of internet speed is really key to making full use of some of the telehealth tools that are available to members. And so we want to make sure that the access that's afforded through digital tools is really applied and expanded equitably. So we're looking at equity through multiple lenses, including geographic, income-based, and certain populations who may need more support than others to make use of the digital tools that are available to them. And we're also thinking about how we might partner with internet and device providers and existing resources that we can make available to our members to make sure that everyone who would like to be digitally connected can be and can use those tools to their full extent in their pursuit of health and wellness. And so with that, I'll turn it back over to Dr. Schuster for any closing remarks, but we appreciate your time and attention today.
Yes, thank you, Ellen. And again, wanted to thank you for the opportunity to talk with you today. We hope that that was useful, although brief overview, and we look forward to hearing your questions and talking with you during the discussion session. Thanks again.